Welcome to our first attendee signing up here today, or logging in anyway, Earl and Linda. If you could please click on the chat button at the bottom of the page. That'll open up a little box that you can type a message in. And if you could please just confirm with me that you can hear my voice. I want to make sure that we have all technical issues dealt with if necessary. All right, good. Thank you, Linda. Thank you, Earl. Earl, I'm sure it's not your first time, but maybe you don't run into many around here. My two older brothers were big football fans. One 8 years older than me, loved the Fran Tarkenton and the Minnesota Vikings. One 4 years older than me liked the Dallas Cowboys, and they told me I could like football, but I had to come up with my own team, and it was going to be either Walter Payton and the Bears or Earl Campbell and the Oilers. And that Houston Oilers fight song convinced me to be an Oilers fan. So now I'm a Tennessee Titans fan, but number 34 still is one of my favorite football players of all time. I'm assuming you're not number 34. There you go. Cool. Well, you and Earl probably share something else in common. I imagine he has some shoulder pain too from his life in the NFL. I'm going to, let's see, I'm going to turn to the recording here now. We are live and on Facebook, and we just hit the 10 o'clock hour, at least time. So I'm going to share my screen here. We may have more people joining us yet. If so, that's great. You should be able to see now. Yeah, there you go. My screen. So if you were hoping to hear about shoulder pain, you're at the right place today. My name is Troy Vandermolen. We've done a lot of these workshops over the last 4 months during the COVID-19 issue online. It's gone really well. We've gotten good involvement and feedback from that. I really like doing it in person when we can, and so we'll probably eventually return to that again. In person, it's much easier to be interactive with you. As you can understand now, you can see me. Hopefully you can hear me, but I can't see you, so I don't get that visual feedback from you. So I'm going to try to find ways to make it easy for us to interact with each other. Some of you have already found that chat button. At the bottom, you'll see a chat button. If you want to type any questions at all, hit that chat button and type into that little chat box, and I'll get an alert that there's a chat that's come up, and I'll be able to answer that question. At the time, I'll ask you to use that chat button to interact with me. In just a little bit, I'm going to ask you 3 important questions I want you to answer, so be ready with that chat feature. I'm going to ask you some poll questions, I think, throughout the day today. I'm hoping I have that set up correctly today so that I can get some feedback from you that way. Your poll responses are completely anonymous, so I cannot see who is saying what on that, but it allows me to understand my audience a little bit better as well. And at the end of our time together, I'll give you my personal contact information, my email address, my cell phone number. So if you have other questions, you can ask those. I generally do stay on at the end of our time together to answer any questions you have at that point too. So we definitely want to be a resource for you and getting your questions answered. I don't know if any of you know me. My name is Troy Vandermolen, and I've been a physical therapist for a long time. 24 years, originally graduated from the University of Iowa, got my doctorate of physical therapy education now about 7 years ago. While I continue to practice, we've seen a lot of people over the years with shoulder issues. It's probably our number 2 issue that we see at our clinic, Kinetic Edge Physical Therapy. Kinetic Edge has been around now for almost 22 years, and I've been around for close to 20 years of those 22 years. So I'm telling you this because I've seen a lot. I've been around a long time. I will freely admit as well that what I did 24 years ago when I started my practice as a physical therapist is a lot different than what I do now. There are some commonalities, but inevitably over time and seeing things over and over and over again, you learn things that you cannot learn by reading a book or the early phases. You just have to see more people to understand the trends and what successes occur. And thankfully, over 24 years, my brain has changed more than the general population's bodies have changed. Those trends are much more apparent to me now, and I understand them better as well. I want you to understand that better so you can apply it to your life. Kinetic Edge has been around for a long time. We got 7 clinics in Central and South Central Iowa, lots of therapists. I told you shoulder issues are very common amongst the people that we serve. I did a little analysis over the past 3 years. I'm estimated that we've done about 20,000 treatment sessions as a group on people with shoulder issues. So that's a lot. And that's helped us learn a lot as well. As a group, we've committed to understand how the body functions exceptionally well, and I think differently than most physical therapy groups. This 3D maps, three-dimensional movement analysis and performance has been exceptionally important because as humans, we exist between gravity and the ground. And what happens to our bodies are influenced by gravity and the ground. And we also understand in three-dimensional movement that your shoulder is part of what's called a dynamic system. In other words, it doesn't exist in a vacuum. It is impacted by things around it. And we're going to learn today that most people's shoulder pain is not a shoulder problem. It's due to another problem external to the shoulder. The dynamic system says that when one thing doesn't do its job well, other things compensate and pick up the slack for that. And your shoulder, a very complex joint system, is particularly prone to issues related to that because of its complexity. I will tell you at Kinetic Edge Physical Therapy, we're also dedicated to helping young therapists or therapists to be get stronger. We have lots of physical therapy education programs that use us. That's great. We're honored that these education programs trust us with their students, but honestly, we do that not because, well, we want to pay it back a little bit for sure, but we do it because it keeps us on the top of our game. Those students ask a lot of great questions, and so it's been great for us to continue to learn, stay sharp because of that. You may be wondering, is this going to be information that I need? But I want you to know that if you're finding that your shoulder pain is over time getting worse and worse, if it's progressively but slowly giving you more fits, well, the end result is usually you end up doing less, which means you become a little bit more dependent upon others. I don't want that. If we can do something about that, I want you to depend upon yourself as much as you can. So this is a good place for you if that's a concern of yours. Nighttime can be problematic for people with shoulder pain. I have lots of people who say, you know, I can feel it during the day, particularly with some certain movements, but nighttime it just really aches. We're going to learn why that's the case today and what you can do about that. If you want to sleep better, this is a good workshop for you. As I said earlier, the dynamic systems model says that my shoulder is influenced by things around it. That's true of you and me as individuals as well. When we experience pain, it's hard to be a blessing to others. And so pain causes us to be in a worse mood, and it makes it difficult for us to help, serve, treat others well. So if you're finding that it's harder to be in a good mood and to serve others, this is a good workshop for you as well. Ultimately, many people that we work with shoulder issues just want to take better care of themselves and care for their families. They're concerned that their shoulder issue is going to prevent them from certain employment responsibilities. And what impact's that going to have on my family and our finances? Those are real issues. I want you to avoid high-risk procedures. We're going to talk a little bit about shoulder surgeries and the prevalence of those surgeries and actually poor outcomes that come from a lot of those shoulder surgeries as well. And every surgery, when you're put under and opened up with a knife, has risks. Less risks today than it was 20, 30 years ago because we get better at this, but it's still risks. And if you're not going to get the outcome you want, there's no need to subject yourself to those risks. And so my goal is to eliminate people having unnecessary surgeries and save the surgeries for the people that we know are actually going to get better as a result of those. We also know that there are some negative side effects of lots of medications that we take when we have pain. We're going to talk about 2 medications. One is a little less dangerous, but we're going to learn about how it's maybe questionable in terms of benefiting us. That's an anti-inflammatory treatment. The other medication we're going to talk about that I have lots of reasons to steer you away from are any kind of narcotics or pain pills. We'll talk a little bit about those very negative side effects as well. Ultimately, it's about moving better, pain-free movements. So I hope that's your goal here with this workshop as well. I'd love to tell you that we have a quick fix for you, but I can't. I'd be lying. There is no quick fix that lasts. And that's not just true of shoulder issues, that's true of back issues, ankle issues, you name a musculoskeletal conditions. Most of these issues, we're going to talk about what cumulative trauma is. Most of these issues are the result of cumulative trauma, something that takes time to develop. You can't get rid of something that is developed over time with a sudden, quick solution. It just doesn't exist. So if you're looking for a quick fix, you are welcome to hang up right now. We're not going to learn about that. We'll learn about fixes, but they're not necessarily always quick. They don't have to be long, though, either. If you want to take control of your own health, this is a good place to be. But if you're saying, hey, I just need a surgery, I know the surgery is going to help me. Again, I wish that was true, but it's not. And so if that's what you're hoping to hear today, I'm not going to share that with you. I do want to ask you some questions, though. So this is your opportunity to hit on that chat button right now. These are 3 questions that I ask every person that comes into our clinic with any kind of musculoskeletal pain. And so I want you to type in that chat box 3 things. Number 1, over the last couple of weeks, what activity have you done that's most contributed to your shoulder pain? So list the activity. Then number 2, on the 1 to 10 scale, 10 being the worst imaginable pain. It's get me to the emergency room immediately type of pain. How high does your pain get on the 1 to 10 scale when you do that particular activity at this point in your life? And then number 3, write down how long you've been dealing with a shoulder issue. Now, most of you are going to say, well, it's not there all the time. It comes and goes. Think back to when it first started. How long ago has that been? Has that been weeks ago? Has that been months ago? Has that been years ago? If you could, please, and I already see some answers coming through here. Okay, come on, chat button, show up for me. There it is. All right, so lifting things, says Linda. So exertion, things that require physical exertion. It can get up to a 10. Okay, that's pretty significant, Linda, for 5 years since the start. And if you've had some surgery and don't feel like it's helped. Okay, we're going to talk about all of those issues, Linda. We're going to talk about how the shoulder is stressed differently when we reach through space. When we exert ourselves, the rotator cuff is called to action. More significantly, when the elbow comes away from the body. And then when you add weight to it, you get a lot of people that just say reaching into the refrigerator to pull out, the milk carton is tough for me now. It never used to be. Those are issues. Or just lifting a plate up to get something in and out of the cupboard in the kitchen. That's an issue. Judy says sanding furniture. Okay, so that forceful action of pressing and moving the arm, rotating, that kind of thing, waxing on and waxing off. Kayaking as well. Can get to a 5 out of a 10, and it's been off and on for about 5 years as well. Okay, great. If more people want to answer, I'm certainly interested in hearing of that from you as well. I want to tell you, though it sounds counterintuitive, if you can tell me there is something that I do that definitely makes it worse, most people would say, well, that's bad news. I'm telling you that's good news. And I'm saying that, getting that, because that tells me that your shoulder pain is reproducible. And again, why is that good news? Well, because we know that if your pain can be reproduced with a particular action, it can also be reduced with a counteraction. That tells us that your pain is not a systemic problem. There are some pretty sinister things that are concerning if you have pain that pretty much stays there all the time. Sometimes that can be a sign of major issues like cancer and that kind of a problem. I don't like that at all. I'd much rather someone tell me, well, it gets worse at times and it feels better at times. That, by and large, tells us it's a mechanical issue. And when mechanical issues exist, there are certain stresses on the tissue that are going to make it hurt, certain stresses that, when removed, make it feel better. And those are the kind of things that we can actually fix. I know if you have that, you're in the right place here at today's workshop. And I've got 3 things, the 3 things we hear the most. When I'm reaching, I feel it, whether I'm reaching forward, overhead, or behind my back. Sometimes that will tell us different things about the shoulder, what kind of reaching, but reaching is a common problem. Lifting, just like one of you mentioned a little bit ago, and then just laying down. And we'll talk about that in a little bit. I want to talk about 2 different kinds of trauma, acute trauma versus cumulative trauma, and I want to graph it out for you using this graph in front of you. So what you see on the vertical axis is tissue damage, or the severity of the issue. over time on the horizontal axis. And then you see a couple other things. This dotted line is your symptom threshold. We can have some changes occurring in the tissue that we don't even feel because it hasn't progressed above the symptom threshold. Okay, and then you see this bucket on the top above the symptom threshold. The bucket's filled with water and overflowing. At the bottom, we got a little water in that bucket. We'll talk about the bucket analogy in a little bit. But let me show you what acute tissue damage is like. We got another comment coming through here. Let's see if my chat button's going to work again here. All right, so Earl says, started 10 to 12 years ago, used heat at night. You're 91 years old, retired 26 years ago, Earl, very good. Truck driver for 50 years. So is it your right shoulder, the gear shifting shoulder, Earl? Now mostly night pain and about a 5. Okay, that's very good, Earl. Yeah, so, oh, it's the left one. Interesting. More often it affects truck drivers on that shifting side, plus that's most people's dominant side as well. But at 91, we're going to talk about some impact of arthritis, and there's probably a little more arthritis there for a 91-year-old than there is for someone like me that's 48. Although we'll certainly learn that arthritis is common and begins a lot earlier than we think, and the good news is more people have arthritis and they don't have pain than those that have arthritis and do have pain. Arthritis is a cumulative issue, but I want to show you first what an acute tissue damage issue looks like. This is when you do something that causes damage very suddenly. This is what it looks like. Sudden tissue damage, and then over time the body takes care of it. We are living organisms, and living organisms get better naturally. We are made to heal. And so the nature of acute trauma, one thing brings it on, and when that one thing then is eliminated, the body does what it naturally does. It gets better. Okay, so we see some of these things. If you fall and land on your shoulder, if there's a fracture or a joint sprain or a significant strain of a muscle as a result of a really heavy task, those are all acute trauma issues, and sometimes those need physical therapy as well. But the most common issues that we see throughout the body, including the shoulder, are cumulative trauma issues, and they look like this. Now, you're seeing this symptom beginning, or the tissue damage changing, crossing that symptom threshold, and it moving up and to the right over the few seconds on my graph. That could literally take years and years and years to develop. So a few things I want you to understand. Down below the symptom threshold, changes are occurring, we just don't know it yet. I think that's a good thing. We don't want to be aware of every little tissue damage issue. We'd be hurting all the time. But when it gets significant enough, we're going to start to feel it eventually. Not everyone's symptom threshold is the same. Every person individually is different with that. And so some people need more tissue damage to feel it, and some people need less. Okay? And the reality is, when something happens slowly, it's first going to start by being a little bit of a problem, not so frequent, not too intense, not long lasting, and then it goes away. But as time goes by, as opposed to acute tissue damage issues, which naturally heal, these cumulative problems naturally get worse as time goes by. So let's talk about why that occurs. When we get exposed to stress over time, water fills our bucket. And though it's a very slow and insidious process, it's also very predictable. The first thing we're going to notice is that we're more fatigued. Okay, when I do painting tasks at home or sanding tasks, I can't do it as long as I used to be able to do it when I was in my early 20s. I need more rest. I fatigue more quickly. That's normal. Unfortunately, we are not going to last forever. So it's normal to have some fatigue as time goes by. And most people will just make excuses for that. They'll say, you know, I'm not as young as I used to be. That's okay. I'll pace myself differently. And we continue to do similar things, and more water fills our bucket. And the next step in this process is, now I'm feeling stiff and sore. Stiffness and soreness is the next step. And that's followed by, eventually, real pain. So pain is different than stiffness and soreness. It really hurts. And if there's any good news about pain, in most cases with cumulative issues, pain still precedes the true tissue injury issues that require more time to overcome. So this is what happens. And our goal with the structured process I'm going to tell you about is to push you back away from this overflowing water issue. And there are strategies we can use to accomplish this. Unfortunately, though, what you've described to me, 5, 10, 20 years of this issue tells me you're on the same path. This issue of frequency of pain, intensity of pain, and duration of your symptoms is probably getting worse as time goes by. That's the typical path that we see amongst people that seek our help. And if you look at the backdrop of my slide here, we've got the train tracks. And if you look in the distance, there's a train rounding the corner and heading towards us. If we don't do something about us, it's going to get worse. It affects our mood, and that negatively affects those around us. Our overall activity decreases, and we know that our overall activity not only will influence our musculoskeletal pain, but it will increase the risk of more significant health issues being a problem in our life as well. And unfortunately, that means high-risk procedures are more likely to be experienced, which, like I said earlier, I'd like you to avoid if possible. And so I'm giving you an opportunity to learn more about a structured process that I have seen over time has much better results than things that tend to alter the problem but not really fix it. And the best news is when we do things right for our shoulder or any musculoskeletal issue, it means we can move better, we can do more. And we can move better and we can do more. That also means we're reducing our risk for other health issues like heart disease and diabetes, obesity, depression. Those 5 things, heart disease, diabetes, obesity, depression, musculoskeletal issues, plus cancer, make up 86% of what Americans spend healthcare dollars on. And the #1 issue easily is musculoskeletal problems. We spend more on that than any of those other top 6 issues. And so this is good for you generally. Now, don't get me wrong. I understand why people tend to want to ignore smaller problems. When your cumulative issue starts to give you a little bit of pain, people don't like to complain. People don't like to be squeaky wheels. And so for a while, the natural tendency is to ignore the problem. And while that is understandable and to some degree applaudable, I will tell you it's the #1 single biggest mistake people make, because if we get to it soon, it's really easy to fix these issues. The same signs that exist well after it's taken place and advanced in its progression are present early. We can find those early and fix those early. It goes away really quickly. Most of you realize, though, it's too far, and you've probably tried things to make this go away. One of you mentioned you've already had a surgery. A lot of people will say they go online, they look for shoulder solutions, they've tried it. You'll realize if you go online that musculoskeletal issues, shoulder issues, how to solve that, it's a multi-billion-dollar industry, but unfortunately most of these issues don't fix the problem, they just alter it, they mask it. And I'm raising my hand, I'm part of the problem with this, or physical therapists are. Many physical therapists, doctors, chiropractors don't truly fix problems, they alter problems. And if you look at the 3 most common treatments for shoulder problems, medications, injections, and surgeries, none of those fix the problem. They all alter the problem. And I'm here to tell you today, if you want to get to the root of the problem, to fix it, you got to find the real problem. And that's what we're going to talk about the rest of today. So I'm going to say to you, if any of you say, hey, I want to find what that real problem is, right now, if you want to, on the chat button, say, yes, I want to do that. What we're giving to people is 20 minutes with one of our movement experts, one of our shoulder experts, to personalize what you're learning today, to find out exactly what you need to make it go away. So like I said earlier, you're going to learn good stuff today, but learning how to personalize it takes one extra step. You need to spend just a little bit of time to find out which of the issues we're going to talk about in a little bit, or which of the, what number of those issues you need to fix to take the stress off your shoulder. And that's the only way to truly solve that problem. Let's see, I saw comments coming through here. Oh, my fault. There we go. All right, Judy says yes. Okay, Judy, that's great. Linda, we'll get you into. If you would, both of you, we have clinics in Ames, Waukee, Des Moines, Newton, Pella, Oskaloosa, and Centerville. If there's one of those clinic locations you'd prefer to go to, just write that down as well. And we also have online options for this too. Some of you are still uncomfortable due to COVID-19 and going out. We're happy to do that through telehealth as well. Okay, Judy, we'll get you in Oskaloosa, great. But I'll tell you, if you come to our clinic, we're doing health screens, we're doing temperature checks. We're making sure that everyone in there is healthy. We're maintaining social distance, lots of cleaning and disinfecting. It's a really safe place to be. But if you'd still prefer the telehealth, that's an option. So Judy will get you an Oskaloosa. Same, Linda, if you could tell us where you'd like to be seen, that's great. Okay, so let's move on. This is the key point I want to tell you about. This is why medications, injections, and surgeries don't get to the root of the problem. When you have mechanical problems that are brought on by some kind of physical stress on a tissue, that when that stress exists creates more pain, and when it's eliminated reduces the pain. When you have a mechanical problem like that, it's not a medical intervention that's going to help you. All right, your shoulder when it hurts, you don't look at a dial that says, oh, looks like my ibuprofen meter is low. I got to refill my ibuprofen. That's not the way it works. Mechanical issues cannot be solved with a biochemistry treatment. That's not how it works. It's a movement-based issue, and the only way to solve a movement-based problem is to give a movement-based solution to that. All right, let's see. Linda, you already go to Wayne County. Okay, very good. So maybe they can help you there. If you're interested, we're in Centerville, and we'd still be very interested in giving you a free screen so we could see you in that Centerville clinic to see if what you're learning there coincides with what we're talking about. All right, Earl, yes, in Ankeny. So let's see, Earl, maybe we could either get you in Des Moines or in Waukee. Maybe Des Moines would be a little bit easier depending on where you are in Ankeny, but we can reach out to you to figure that out. That'd be just fine. All right, so again, mechanical issues, movement-based issues mean movement-based solutions, medications, injections, and surgeries. Just try to make it feel better, but does not solve the movement-based issue. And that's why lots of people that have had surgeries continue to have problems, because while they might have gotten rid of some of the degenerative changes or damage that has accumulated over time, the movement-based issue has not been solved. We're going to talk about what those movement-based issues are in just a little bit. Here's another thing, and I don't want to get too in detail about this, but anytime you hurt, anytime tissues are damaged, we go through a healing process. And that healing process has 4 stages. And if you look at phase 2, that's the inflammation phase. So it's really common that when we start to hurt, we'll look at taking an anti-inflammatory, either an over-the-counter anti-inflammatory like ibuprofen, Aleve, something like that, or we'll get a doctor's prescription for a prescription anti-inflammatory. And I completely understand why that's desirable, because inflammation does contribute to our discomfort, to our pain. But inflammation exists for a reason. That phase of healing, the inflammatory phase, prepares the body to lay down a matrix of blood vessels. And as that goes forward through proliferation and remodeling, that matrix matures, and blood can get to that tissue if the process continues. And that's really important, because blood carries oxygen, and blood carries all the nutrients that keep tissues healthy. And so if we take an anti-inflammatory and stop the inflammatory phase, it blocks us going into the 3rd and the 4th phases that restore normal nutrients to that tissue. So this is really important. One of my favorite authors of all time is an author who's been gone for a long time. His name is C.S. Lewis. He wrote many books. One of them was actually a shorter essay called Miracles. This was written during the time of World War II. And here's the quote. It says, "The magic is not in the medicine, but in the patient's body. What the treatment does, or what successful treatment does, is to stimulate nature's functions or to remove hindrances." So what C.S. Lewis is saying is, there's no physical therapist, there's no medical professional, no chiropractor that has magic healing capabilities. If any of them are going to do anything that's good for you, it's enabling, it's the treatment that they provide that enables the body to do what it's created to do, what it's naturally designed to do. And so an anti-inflammatory doesn't enable the body to do what the body is naturally designed to do. It actually stops what the body's naturally designed to do in the inflammatory stage that progresses forward to phase 3 and phase 4. So I'm not magic, the doctor's not magic, no one's magic. Anyone that can do anything for you either helps the body do what it's naturally designed to do, or removes hindrances that prevent the body from doing what it's naturally designed to do. And so that's what the rest of today is going to be all about. And I want to talk to you about John. So it's kind of interesting. We've got Earl on here, who's a 91-year-old gentleman. John is a guy, he was 92 years old when he came to me. shoot, this is close to 20 years ago. And so he came to me. I was working in a different area of the state than I was working right now. He came to me. He had seen many doctors because of shoulder pain, continued to have problems despite the treatments that they did. Eventually had an MRI done that showed a massive rotator cuff tear. And he couldn't even get his hand to the top of his head. His shoulder shrugged, it hurt. And he's like, they told me I could do surgery, but that's hard on my heart. I don't want to do that. So he goes, I just want to move a little bit better. I want to be able to fix my own hair. I want to be able to get something out of my cupboards. He was still living independently, and he wanted to continue to live independently, but his shoulder was really a major problem for him. The good news is about John, he had a great attitude. And so I told John, I was a young physical therapist then, and I told John, hey, I wish I could fix that rotator cuff issue. I can't. But I said, I think we can make some other things around that shoulder work better, which should make your shoulder do its job a little bit better with less pain. So are you willing to do that? And he said, let's go for it. So he worked hard. For about 5 or 6 weeks, we worked together a couple times a week. He went home and he did what he was supposed to do, the things that I taught him. And lo and behold, honestly, as a young physical therapist, I wasn't too confident that it was going to be better. But lo and behold, he said, you know what? I have a little discomfort, but it's small compared to what it used to be. I can now easily get to the top of my head and I can get to my shelves. All that was a whole lot better. And he's like, I'm glad that I came here. I'm glad that I've done this. And by the way, it wasn't just shoulder stuff that we did for him. He needed thoracic spine work, and we'll understand how the thoracic spine, the shoulder blade, the shoulder, all those things work together. And by the way, we're going to talk about the importance of your hips as well. We did some hip things with John too. So John is an example of why I teach this stuff. He could have done a surgery, but it would have been risky for him. And he found that he didn't need that surgery. He worked hard at doing the things that he could control, and he got better. And we tell a lot of people about this stuff because, frankly, I have some great friends. Some of my best friends are doctors. 2 in particular are family practice doctors. One's an emergency room doctor. And they are exceptionally knowledgeable about so much of the human body. But medical doctors know very little about musculoskeletal issues. And musculoskeletal complaints, it hurts when I move, is the second most common reason people go see the doctor. So they're not very well equipped to help people with musculoskeletal issues. In fact, most doctors don't get musculoskeletal training. They get a little bit of book learning at the start, but not much practical training. So I talked to them, they're like, I don't know what to do. You guys can see them. Those are the people that need to get to us, the movement experts. We know that lots of times people get prescriptions for things that can be really hazardous for them. If you're interested, I would encourage you to write this down. Keep the wolves and opioids away. Opioids, painkillers, narcotics. Over the past 5 years, we've learned how significantly problematic those things are. You can see right there the statistic that says in 2019 alone, 70,000 people accidentally overdosed and died from opioid use. Now, some of that was illicit use of heroin, but some of that was also people that had gotten prescriptions. That video, Keep the Wolves and Opioids Away, is done by a physical therapy group 4.5 years ago in Colorado. And there are 2 things in that short little video that stuck with me. Number one, Americans make up 5% of the world's population, but they consume 80% of the world's opioids. So we have an opioid problem, both with illicit and prescription use. The number 2 issue is, or the number 2 statistic that stuck out to me with that video, of those that get a prescription for opiates, painkillers, 1 in 4, 25% of them develop an addiction. So that is a major problem. They're highly addictive. They do not get to the root of the problem, and they can be really problematic in that they kill people. So we need to reduce our dependence on opioids in America, no doubt about it. We also know that surgeries are increasing dramatically, over double the number of surgeries for shoulders are being done today than 10 years ago, and it's not helping people. So we need to get rid of these patterns that have proven to be not very effective and choose to do the things that are truly effective. And so for the rest of our time together, we're going to talk about what are the most common types of shoulder pain, the causes of those pain issues, and what we can do to actually get to the root of that problem. So let's take a quick look at what your shoulder joint looks like. So we've removed muscles, most of them anyway, most of the ligaments. We're looking at bone, a few ligaments, and a few muscles and tendons and some other stuff. The shoulder joint is actually made up of 4 different bones. You got the collarbone, you got the shoulder blade, you got the humerus in that area. And actually the issues mostly exist right here in what we call the subacromial space. So below this little bone of your shoulder blade called the acromion is the subacromial space. This one rotator cuff, one of the 4 rotator cuff muscles called the supraspinatus goes through here. It can get impinged in this area. So this is a problematic area. We've got a bursa in there, a fluid-filled sac. So you've probably heard of bursitis and tendinitis. This is where bursitis and tendinitis exists in the human body. The shoulder joint proper is where the humerus bone meets with your shoulder blade in that area. It's a ball and socket joint, but it moves in a very complex way. In fact, we can talk about that. We have 4 rotator cuff muscles. The supraspinatus joint or supraspinatus muscle is the most common involved in shoulder problems. Like every body part, the shoulder moves 3-dimensionally. I'm going to show you what that 3-dimensional movement looks like in just a little bit. But it's a really complex and significant amount of motion. It is the most mobile joint in the human body, and so therefore, dynamic stability from all of these muscles is really important. We're going to learn a little bit how the shoulder blade actually has a significant number of muscles connected to it. And so any bone that has that many muscles connected to it is a really important bone in human function. All right, so let's talk about types of shoulder pain. I want you to understand that when we talk about a shoulder pain type, we're simply describing it. We're giving it a diagnosis. We are not yet talking about a cause. One type of shoulder pain can be caused by many different things. And again, treatment depends on understanding the cause, not knowing the type. That being said, it's interesting to understand what type of shoulder pain we have. And I'm going to talk about 3 types. The most common 3 types are osteoarthritis, impingement, and rotator cuff issues. And by the way, all of these things actually can be offshoots from the root one, arthritis-related issues. We'll talk about that in a little bit. Osteoarthritis is literally joint inflammation, and it will often be associated with cartilage change. So it's some degenerative changes. You'll hear words like degeneration, joint space narrowing, even bone on bone is used. You'll hear bone spurs. Any arthritic issues that affect the cartilage, which is very common, is usually not going to contribute to pain because cartilage, for the most part, is aneural, meaning it doesn't have nerve endings. It cannot sense pain. So cartilage change is a sign of something, but it won't often cause directly any pain. So that's interesting to know. The other thing to note is that 40-year-olds with no shoulder pain are very likely to already have evidence of some arthritis. 89% of them do. You look at it under an MRI. And so I'll repeat what I said earlier. It is more common for you to have arthritic changes and not have pain than it is to have arthritic changes and experience pain. And any surgery to remove signs of arthritis through debridement, arthroscopic stuff, and that kind of issue isn't getting to the root of the problem. So it might make you feel better temporarily, but it usually is not a long-term solution. So we tell people that having arthritis in your shoulders is as normal as having wrinkles on your skin. It's a sign, but it's not a problem. So arthritis is exceptionally common, but very treatable in most cases. Impingement is a second issue. So impingement occurs in that subacromial space. Because of repeated movements and pressure on the tissues that are in that subacromial space, that bursa gets additional pressures. The supraspinatus muscle and tendon gets more compressive force. And as time goes by, that compression, that stress on that tissue is beyond what the tissue is designed to handle. And it starts to change. Impingement-related signs create inflammation in this area, either of the tendon or that bursa. And so impingement is also extremely common, okay? I'm gonna go back a little bit here. Impingement occurs in the subacromial space. So those of you that have had pain that gets worse when you lay down, as you stand up, upright and vertical, the space here between your acromion and the top of your ball and socket joints about 5 millimeters. So not much space, and that's where that stuff travels between. As soon as we lay down, that space starts to narrow. And when we lay down, we're no longer moving, and that's when inflammatory processes spike. So when you have inflammation filling space in a position where you reduce the space, because you've laid down and reduced the subacromial space, that's why people have nighttime pain. And nighttime pain is very common with impingement issues. Impingement is often not detectable on diagnostic testing. And I will tell you that it is very, very treatable with conservative care. It is not very treatable with surgical intervention, okay? If you were in the clinic right now, I would do a test with you. You can do it right now if you want to figure out if you have impingement. What I want you to do is to put your thumb up, stretch your arm out, and just raise it up in front of you or out to the side a little bit. Many people with impingement will say they get to a certain height and they can start to feel a pinching in that shoulder, and then it feels a little bit better, and then at the very top it starts to pinch again. Now, if you do the same thing but turn your thumb down before you raise, most people are going to say at that point they get quicker and more severe pinching in their shoulder in that thumb down position. That's called the Mears test. So that is a sign that would indicate you may have more impingement related issues. But remember, impingement is because tissues put pressure, things put pressure on that stuff in the subacromial space. And if you have osteoarthritis and you start to develop bone spurs, well, those spurs will put pressure on that too. That's why arthritis and impingement are often closely related. I also want you to understand that impingement of those structures is really normal. Pressure in that shoulder is normal. Our body's designed to handle pressure. Symptoms only occur when that pressure's been around long enough and significantly enough to start to create more substantial changes to that tissue where you've crossed that symptom threshold. And those symptoms will continue unless those forces are reduced. That's always a movement issue. There's something at the root of that problem. Now, rotator cuff strain or tearing, that's the third type of shoulder pain that we see most commonly in our clinic. So on the left here, you start to see the buildup of inflammation on one of the rotator cuff muscles. That's the supraspinatus. At least 9 out of 10 times, that's the one involved. You got other muscles there too. There's one that's involved with external rotation of the shoulder that can also be involved. Now, this is a more massive tear. In real life, you have this much tearing occurring, and this muscle is going to start to retract from its connection point. Okay, the more severe that tear is, the less likely it can even be fixed surgically. Again, if you are older and you've been experiencing pain for a while and you're eventually told, well, I know I have some tearing on my rotator cuff, that's pretty normal as well. And a lot of people with rotator cuff tears don't even know it because they don't have pain as well. Here's some statistics for you. 60-year-old and older with no shoulder pain that have an MRI show evidence of some degree of rotator cuff tearing. No pain. More than half of you, 54% of you that are 60 and older have a rotator cuff tear. Under age 60, 34% of people under age 60 have a rotator cuff tear and don't know it because they don't have shoulder pain. And there's more recent studies being done that show that PT and other conservative treatments are just as effective as surgical intervention. And I will tell you, PT that focuses on getting to the root of the problem is more effective than surgery. A bunch of other studies here. I'm not going to go into the details. These are of, some of these are like pitchers with major stresses on the shoulder. A lot of pitchers have damage and they don't know it because they don't regularly experience pain. The one I do want to point your attention to, the bottom two here actually. Even people that have successful rotator cuff surgery, 1 in 3 of them continue to have rotator cuff tears. And 1 out of 5 of them, actually more than half of those that have successful rotator cuff surgery continue to have complete rotator cuff tears, not just partial tearing. And then there's something called the Sham shoulder surgery. People that had an arthroscope introduced into the shoulder. Some of them actually did some work when they were in there. The other ones, they didn't even do any work. They just introduced the scope. Outcomes between the two groups, real surgery and sham surgery, were no different, okay? So my point is this. The presence of a pathology does not correlate with pain. The presence of a pathology, even if you have pain, does not ensure that getting rid of that pathology is going to make you feel and function better. The true solution is getting to the movement-based issue. All right, so let me Oh shoot, I don't have my polls on here today. My apologies on that. Let's just move forward with causes of shoulder pain. Okay, so I told you earlier, what we just talked about with arthritis, with impingement, and with rotator cuff issues, those are all types of shoulder pain, but many different things can cause the same issues. And so we're going to get to the real root issues here. Believe it or not, there are 3 things external to the shoulder joint that are most commonly associated with the true cause of shoulder problems. So we're going to talk about your shoulder blade. We're actually going to talk about your hips today. Your hips contribute to how your shoulder functions. And then we're going to talk about kind of your thoracic spine, rib cage issue too. All right, so let's look at the shoulder blade first. A little bit ago, I said that there is a particular area that has 21 muscles connected to it. That's your shoulder blade. So that is a really important bone. Your shoulder blade is part of the shoulder complex. And all those muscles attached to the shoulder blade would say, hey, there's a lot of different movements that shoulder blade can and should make if it's doing its job appropriately. Remember earlier when I said your shoulder, like every other part of your body, is part of a dynamic system. It is influenced by what's happening around it. And so all these muscles connecting to your shoulder blade have to do certain things to enable that shoulder joint to move and act efficiently and functionally. We talk about a dance that occurs when you do something as basic as raising your arm overhead. From arm at the side to arm overhead, that's 180 degrees of motion. But that is due to 2 things occurring. First of all, it's due to your shoulder blade rotating upward. And you can see on the bottom right here, 60 degrees of that 180 degrees of motion occurs because the shoulder blade elevates and rotates on your rib cage. The other 120 degrees happens because your humerus, upper arm bone, is moving on the shoulder blade. So what happens if that shoulder blade doesn't move the way it's supposed to? Either it doesn't move as much as it ought to, or it doesn't move with the right timing, which is sometimes an issue. Well, let me show you this. This is a skeleton. I'm going to show you a video here. What you'll see is what happens, this relationship between your upper arm and the shoulder blade, when you raise your arm up to the side, up in front, and then reaching behind your body. Watch this dance that occurs between your shoulder blade and the upper arm bone. This is a normal functioning shoulder complex. All right, so I think what they first do is they raise the arm up, out to the side. You can see that shoulder blade is rotating upward and arm continues to raise up 120 here and 60 degrees there, and there's still space between those bones. When each of those bones dynamically move the way they're supposed to, there's no extra pinching occurring in the subacromial space. And if your shoulder blade doesn't move, if it stops moving, let me pause this a little bit. If your shoulder, and I'm actually going to stop right here. Okay, watch again as this thing raises. Let's say right there, your shoulder blade can't move any further. It stops. And your arm continues to lift. The arm continues to lift, you're going to eventually get some pressure in that subacromial space. But in this particular person, that shoulder blade continues to elevate, and the arm humerus, the head of the ball and socket, doesn't put pressure in the subacromial space. That's what's supposed to happen, but all too often shoulder blade issues, dysfunctions of the shoulder blade, create a system that causes pressure in the subacromial region. All right, so this is gonna lift out in front, not out to the side, only to about 90 degrees. I wish they'd go a full 180 because you'd see something different, but the first part of lifting forward to 90 degrees, the shoulder blade is retracting away from the shoulder, or from the thoracic spine. If it kept going higher, it would start to rotate a little bit more. When the arm drops back down here, you'll see the shoulder blade is returning to the thoracic spine. Now this skeleton's gonna reach behind his back like he's putting something in his back pocket or scratching his bottom. That shoulder blade continues to retract. Actually, it protracts when it comes way up, retracts when it heads in. I spoke poorly earlier there. Okay, so you can really appreciate with that dynamic model, the movements that need to occur to eliminate stress from that subacromial region. So I will tell you, if you have sought treatment for your shoulder, and they have not looked at how your shoulder blade cooperates with the arm, it is very likely that something really critical has been ignored or missed if you're looking to eliminate your shoulder pain. So as therapists trained to understand three-dimensional movement, we look very closely at that, and we have means of helping you restore normal shoulder blade mobility. Now the hips, that one, honestly, when I first learned about the world, the hips, what's going on? Well, it makes a lot of sense when you think about it. We've got a few pictures here. This first picture, you can see how on the front of the body, what we're seeing are fascial bands and muscles have a diagonal pattern to them. So that connects your left hip to your right shoulder, your right hip to your left shoulder. Same on the back. Your left hip through your thoracolumbar fascia connects to your right latissimus, and that connects to your shoulder. And so there's a relationship between right hip and left shoulder, left hip and right shoulder. And there's a relationship between right hip and right shoulder as well. I'm a big baseball fan. Yesterday, opening day, my Kansas City Royals lost, but it was a joy to watch them lose because I love baseball. I love working with overhead throwing athletes because the shoulder joint is so complex. And lots of times hip issues and baseball players contribute to shoulder problems. Think about this for a moment. If a ball gets hit in the gap between two outfielders, let's say it's in the left field gap, the left fielder and the center fielder are converging, the runner grounds first and he's going to dig in and he's going to try to stretch the single into a double. The center fielder grabs the ball. Okay, think about what he does. He plants his foot, all his momentum heads towards second base as he delivers a laser to second base, a frozen rope. But it starts with him planting on his right foot to develop this movement chain and that travels all the way through the hand. Let's say for a moment the rule in baseball is you can't throw from your feet. You got to get on your bottom. How far could a person throw if they had to sit on their bottom? We cannot transfer motion and forces through the hips very well if we're on our bottom. So dynamic movement of the hip helps the shoulder function well. So it is said that the hip provides 50% of the help during the load to explode phase when we make shoulder motion occur. And hips also are very dynamic in 6 directions through 3 planes of movement. So again, I would say if you've had someone help you with a shoulder issue, but they've not assessed how the hip moves, a major issue could be missing. And actually for John, we did a lot of hip stuff and thoracic spine stuff, which we're going to talk about next. The thoracic spine of your rib cage is the channel upon which the shoulder blade rides. And so movement of the shoulder blade depends upon good movement of the rib cage and your thoracic spine. And it moves 3-dimensionally as well. Any limitation of movement of the thoracic spine, your torso, your rib cage, reduces the effectiveness of your shoulder blade and therefore enhances the likelihood that movement issues are going to add up in the subacromial space of the ball and socket joint of the shoulder. So I'll say it one more time. You need to have assessed how your hips move, how your thoracic spine moves, how your shoulder blade moves if you want to eliminate the primary movement-based causes of your shoulder problem. All right? All right, so let's go to the last phase here. What does it look like to eliminate shoulder pain, to truly get to the root problem? And I will reiterate one more time, although anti-inflammatories and injections might make you feel good for a little while, although surgery might eliminate some of the degenerative changes that occur from cumulative trauma. If you haven't gotten to the movement-based root issue, you really have not solved the root problem associated with that thing. And so I talk to a lot of people, and I want you to hear what I'm saying, don't hear what I'm not saying. I have people do rotator cuff exercises. I have them lay down and I stretch them. All of those things are good at helping the shoulder joint function the way the shoulder joint is supposed to function. I include those in my treatment, but I use that as a way to step from phase 1 to phase 2. Phase 2 involves these things. It needs to be whole body. Your shoulder is influenced by what's happening around it, and we exist between gravity and the ground, which means this progressive function of movement, kinetic chain movement that goes from the foot to the knee to the hip to the thoracic spine to your shoulder blade to your arm, needs to be considered in functional positions. So it's a whole body issue. It's not just treating the shoulder, but it's treating the thoracic spine and the rib and the shoulder blade and the hips. I also believe that true successful treatment is both educational and empowering. What I mean by that, they're two different things. Education means, here's what you need to do. Empowering means, here's when you need to do it. There is the right thing to do at the right time. And that's why successful treatment in our environment usually takes between 4 to 6 weeks to accomplish. And it's between 7 to 10 treatments or so. It is illegal for physical therapists to work with multiple clients simultaneously. I will tell you that though that's legal, it's not helpful. And so if you've ever done physical therapy or any kind of medical care where a person was going between you and other people, that's not going to work because your individual needs are not being taken care of in that setting. And hands-on treatment, particularly when we add hands to functional movement. So what I mean by that is sometimes hips are really tight. And we see that when we start to move dynamically. And so to make your shoulder do what it's supposed to do, to take the stress off that subacromial space, there are times where I have people doing light lunging movements and I'm helping facilitate hip movement with my hands. That enables that hip to learn how to move in a functional way to cooperate with the thoracic spine, the shoulder blade, and the shoulder joint proper. All of those things are really important if you want not just short-term pain relief, but long-term success. Now, I also want you to hear what I'm truly saying. If you're 91 years old, or if you've been experiencing pain for 10 or 15 or 20 years, I'm not going to tell you in 6 weeks you're going to feel like a 20-year-old. In many cases, success means frequency, intensity, and duration. Instead of it slowly worsening over time, you're seeing that it's not as frequent, it's not intense, the duration is minimal, it takes much more until you start to feel shoulder pain. But I cannot promise to you that you're going to be 100% successful at eliminating pain forever. But I can 99.9% sure that we can reduce frequency, intensity, and the duration of your symptoms, in some cases, in pretty dramatic ways, if you get to the root of the problem. Getting to the root of the problem means it's not progressively worsening as time goes by. We're able to get rid of the stress and get you back below the symptom threshold again. So I'm going to reiterate what I said before. You've probably nodded your heads a lot today. You've probably heard a lot of stuff that resonated with your experience in life, but you're not going to be able to remember everything I've told you. And I've not yet gotten to the point where I can say, it's your hip that needs real solutions. It's your thoracic spine. You need to spend a little time in a one-on-one environment to do that. Knowledge isn't powerful unless you can apply that knowledge. So that's what the solution looks like. If you take us up on this, you just spend 20 minutes with one of our shoulder experts, and in that time, they're going to ask you questions, they're going to listen closely, and then they'll do some very simple assessment techniques, and they'll be able to say, here's the root problem for you, or here are the root problems for you. And if you fix these things over time, here's what will happen to your shoulder. Here's what natural, effective solutions getting to the root of the problem would look like for you, okay? And ultimately, I'm doing this, like I said before, because too many people spend too much time, energy, and money on things that do not get to the root of the problem. Too many people are getting rich on temporary help, on masking the problem. And I want you to have effective solutions. That's why we're doing this, okay? Typically, that time would cost about $150. We're not charging you a thing. And actually, we're giving you a guarantee, too. If you do that and say, well, that was a waste of my time, just tell us. We'll give $150 to the charity of your choice. Now, we love doing that. Yesterday was opening day. We had something called Caps On. People got to wear their baseball gear, and they picked a nonprofit organization that, like us, exists to transform lives and restore hope. And whoever got the most votes on Facebook by liking or sharing it, they're going to be able to give some money to a charity, a little less money for number 2 and a little less money for number 3. We love helping charities, but I don't think you're going to probably take us up on this because the time that you spend with us will be very valuable. And again, at that point, you kind of understand what the plan would be like, but there's no obligation. At that point, you can take it or leave it. So if you want to do that, all you got to do is click on that chat button and say, I'm in. Or if you're really technically proficient, you can pull out your smartphone camera, put it on this QR code, you hold the camera on that, and a little link will pop up on your screen. Just click on that link and it takes you to our website. You put your first name, your last name, your email address so we can contact you, and which of those 7 locations or online telehealth would you like to do that in. Now, here's my information. That's my direct cell phone number. So you can call or text that cell phone number if you have other questions. You can email me at that email address right there. So write that down if you want to. I am actually going to stick online here though. If you want to be signed up, make sure you either click that QR code or write it in the chat box so that you can get assigned to one of our movement experts at one of those 7 locations. But let me stop the share here, and that allows me to see your responses a little bit easily. All right, so if any of you have further questions, I'll keep it going here. Any specific questions any of you attending would like to have answered? Happy to answer them right now. Does this all make sense to you? Is this like anything you've heard in the past? I'll be honest with you, 24 years ago when I was leaving the University of Iowa, by the way, at the time, and I think it still is in the top 3 or 4, at the time it was the #2 rated physical therapy education program in America. It has a great reputation. And I learned a ton. It got me ahead in life, no doubt about it. But the way that people teach how to treat the human body is still different. I learned a ton more by seeing how people move. And that's made me very thankful for what the University of Iowa has given me, but that's made me see things in a different way. Earl, does Medicare pay for treatment? So yes, I'll reiterate, the screen doesn't require insurance, that's all free. But if treatment is required or requested and you say, yeah, I want to do that, Medicare will cover that. We just have to do one of 2 things. We'd have to call your family doctor and say, hey, we've seen Earl, here's what's going on. Would you send us a referral for that? Or in many cases, we can do the assessment, send that to the doctor, and they'll sign off on it. It's called a signed plan of care. So as long as we have a signed plan of care or a doctor's referral, yes, Medicare will pay for that. It's a covered treatment. Judy, yes, it makes sense. I've had issues with the hip and spine. So yes, Judy, I didn't say this earlier, but lots of times we will see people, for example, if you have low back issues and shoulder neck issues, the most common denominator for those issues is your thoracic spine, but the hip as well. Hip is a little bit more likely to contribute to lower back and knee issues, the closest neighbors, but it certainly contributes to shoulder issues too. All right, so Linda, very informative. So you're saying, for instance, the physical therapy I had after surgery wasn't that great? Well, I will tell you that many times physical therapy does a good job doing the early stages, but doesn't get to the last stage, which is helping make sure your shoulder can function in concert with your hip, your thoracic spine, and your shoulder blade. So I would say that what I've seen over time is that many physical therapy experiences have been good but incomplete. So I would say it's not that it was bad, but it may have been incomplete. If you didn't do things to train your shoulder how to function with your foot on the ground, implementing movements that involve the hip, the thoracic spine, your shoulder blade, and the arm, it may not have been complete. Right hip replacement, Earl, yeah, we see that a lot, for sure. Now, we're not going to twist and torque that hip to all the end of the ages of that thing, but making sure that hip's doing what it's supposed to do will be really important. So right hip and left shoulder for you, Earl, that kind of fits a pattern that we've seen very commonly over time. All right, so good. For those of you that have chatted on the chat message area, we will contact you. I'll have the care coordinators at each of those clinic locations give you a call on Monday, and we'll find a time that works really well for you. In the meanwhile, or even after that, if you have questions, continue to reach out through the means that I've given you. You will receive an email, I think in an hour or 2 after I hang up here. On that, you'll have a link to this video. And if you have other people in your life that you love that have dealt with shoulder issues, please forward that to them if they want to watch that. That's great. We want them to do that. If you're on Facebook Live, you can put on comments or direct message us if you want to be seen too. We're happy to do that for you on Facebook Live. That email you get from us if you signed up on Zoom is another way you can interact with us. So just send that a reply to that email. that eventually gets to me too. So happy to help you with that. Thank you, folks. I appreciate you giving me an hour of your time on a beautiful Saturday morning. And I hope it's giving you some hope. Our mission at Kinetic Physical Therapy is transforming lives and restoring hope through movement. And so hope is big to us. Hope's a difference maker, and we hope you get a little bit more of that. Yes, Linda, we actually do workshops on back issues too. So, you know what? I will have the people that respond to you on the email send you also a link to an old back seminar. Let me write this down so the people that read the chat see that. We'll send you a link to our lower back pain workshop too, Linda. There you go. Please do that, Tassie or Erica. Thanks. What you're going to learn when you watch that, Linda, is it'll sound very much the same. We talk about one different issue. We talk about hip and their contributions on back issues, lower back issues. We talk about the thoracic spine, but there's one other issue that's a little bit unique to shoulder problems that can contribute to lower back pain related problems. So that'll be interesting. The first 20 minutes of my conversation are very similar because we set up the information, but then when we talk about the types and the causes, that's when you get some of the unique information on that. All right, Judy, yes, we'll send that lower back one to you as well. And you can keep an eye out. We do live one of those over 2 weeks' time. I do one online workshop for 4 different conditions: lower back pain, shoulder pain, knee pain, and foot pain. So that's another way you can keep an eye out for that as well. But Judy and Linda will certainly, I'll have Tassie or Erica send you an old recorded link to a YouTube video that you can watch there too. All right, folks, thank you very much. Be a blessing today. Take care. All right, Judy, maybe we can sing you the knee pain one too.